My name is Dr. Jane Goldberg. Welcome to my show, Musings from 20th Street. I am a psychoanalyst, and I also own La Casa Day Spa, which is a seriously holistic day spa on East 20th Street. Today is the 36th session of my Really Real Reality group therapy show. We lost one of our group members the last session, and so we spent some time talking about whether it was a suicide or a murder. So I thought I would say a little about psychosomatic phenomena. They studied cancer patients in about the 20s and 30s, and they came up with a cancer personality profile. People who get cancer are more likely to be not experience consciously their aggression. They're lovely people. They're really nice people to be with because they're very compliant, and they're really nice, and they go along with everything, and you feel really good with them. But the personality profile shows that underneath that veneer of pleasantness is a lot of kind of agitation and rage. But therein, the disconnect and the discrepancy between what's on the surface and what's underneath, of course, is problematic, and sometimes results in an imbalance of body chemistry, which can affect the immune system, which affects the proliferation of cancer cells. And same with heart disease. Of course, we have the type A personality, which is a very hard-driving, ambitious, and sometimes prone to a lot of outbursts of temper and rage. So we do know that this psychosomatic phenomenon is real and possibly even pervasive, and it is possible that instead of being completely a murder for our lost group member Paul, that it was also a psychosomatic reaction that he had that made him feel so sick that he felt he couldn't participate with us. So with that said, I want to again remind my group members that we're here to help ourselves and each other process our internal worlds and our internal lives, and that we're not here to kill each other. We may want to, and I welcome the desire to want to kill each other, but we're here to verbalize that desire as opposed to acting it out.
I mean, I feel kind of bad that maybe we were a little tough on him, but he seemed so resistant that it seemed very difficult to get through to him.
Yeah, I think sometimes when the defenses are so strong that what it stimulates in you is the desire to pound away, and you're going to get through if you just keep pounding a little harder, that it's really hard to resist that impulse. And it's possible that that's what we were all doing. And by the way, I'm as guilty as everyone in the room, because I did give an interpretation to him about the meaning of his disagreeing with me about psychoanalysis, and that it might have arisen from, I didn't use the word competition, I used the word challenge. And that might have been too much for him.
Well, but I thought you did it very nicely. I mean...
Yeah, but without his giving feedback about what he was experiencing, we don't know what effect it had.
I thought I saw too smooth and nice. A chip on the shoulder, stubborn, wouldn't yield to a simple request which he just wouldn't take in, to say, I'm angry, or I'm hurt, or I don't like what you're saying, just something simple.
But I think that Jane's got a point, is that
I'm
he
not disputing that.
No, but he may seem really strong on the exterior, but inside he may be completely destroyed, because if he gets anywhere near what he's really feeling,
he's going to go to pieces.
He's going to, the whole...
Well, aren't I aligning with Jane when I say he had like kind of too smooth chip on the shoulder,
what
sort
you
of?
said was quite wonderful, Walter.
Oh, thank you.
I don't think anyone was criticizing.
I wanted to ask you a question about what you said about cancer and heart disease and all of this, because studies have also come out. I mean, I'm one of those. I don't know if I don't know if you see me as a type A personality, because I do have bouts of anger, but I am driven, but I never succeed. But they came out with a study that if you have so much anger and depression, that causes heart disease and cancer. And I know for a fact I do have hardening of the arteries, and that's not from just the food I ate. That they said it was due to stress and depression, because you get what is it? How do they call it? Your chemistry, the cortisol and the adrenaline. It all floods the organs, and you get inflammation. Is how they put it.
Barbara, do you work out or exercise?
I walk a lot. I should be working out a lot more, but I'm very tired a lot. I'm very fatigued a lot.
Yeah, I'm a depressive. I always feel like that.
I mean, people think
I
I'm
get tired.
manic, and I'm not. You know what?
Like I'll wake up and be tired. And
Yeah, well, I could sleep 20. I literally, if I don't have anything to do, I'll stay in my bed all day.
That's what I
And
did
that's a
yesterday.
bad thing. I'm doing my mother, which is really frightening.
Okay,
My
so this
mother's
is
very
kind of
bad.
interesting since y'all were mortal enemies.
No, that's what happened to me
last
yesterday. I'm
session.
a depressive, and I was supposed to go to Brooklyn.
So the process of what's happening in this room is interesting to me.
Yeah.
More interesting than your depression that you woke up with, and that is that you've gone from, attacking her and hate and really not liking her, to having empathy for her. I find that interesting.
I don't dislike Barbara. I don't like. I
don't think you dislike her like permanently and eternally. At that moment, that you were.
We may have gotten off on the wrong foot with each other. I'd like to think
No,
that.
no, I don't agree with that. I think at that moment you had a visceral, negative response to her, and it was fine, except that you weren't exactly saying it.
Yeah, I'm one of these people who's like, I guess I don't know if it's a tough skin or if it's just a defensive mechanism, but it's like I tend to shut down. Like if I'm being attacked, I just shut down.
Well, you weren't
Well,
shut
you
down.
weren't shut down today.
No, well, because I was, I have to acknowledge my feelings. So yeah, I did make that attempt. but-
You were like me, exactly. We were like each other.
No, like
That
I was saying,
reflected each other.
maybe you and I have too much
Barbara,
in common.
that's
Maybe
absolutely
That's
right.
true.
You
maybe-
were my mirror image today.
That's right.
It was like me yelling at myself.
Well, that's what I'm saying. I think
In the
people
last
have a weird
session.
way
Yeah.
of identifying, and maybe unconsciously we identify on another level.
Yeah.
When she said that she sleeps a lot, I said, well, yesterday, 4 o'clock, I went to bed. You
Yeah,
know, and then
I'm
I
known to do
slept
that too. Just
like
sleeping.
till this morning
Yeah.
to come here, and it's like I felt fine. But yesterday,
So the first question I ask my cancer patients when they come in, because I do have, I kind of specialize in working with cancer patients. If they come to my office, they already have an idea that there's a psychosomatic component. So the first question I ask them is, well, why do you have cancer? What's causing your cancer? Now, some people say, I don't know. That's okay. I appreciate. I assume that they don't really know. But the question is an invitation to look at it. So I ask the same thing about depression. Well, why are you depressed?
that's what I'm in. All right, I know why I'm depressed, but I don't know how to pinpoint it. But my depression is something that is, I think it's like a rage thing that goes back to my childhood. I did 12 years Catholic school when there was corporal punishment, that sort of thing.
Me
so
too.
I was getting smacked around by complete strange adults, that sort of thing. And so I mean, not that I don't know. It doesn't. I shouldn't be talking about it because it really doesn't bother me now. But I think
No, you don't
I
know
think it
that.
does bother you.
I think yeah. I
It,
think
doesn't
does bother
consciously
you.
bother you. It doesn't mean that it
Yeah.
didn't make an imprint on your
Right.
neurology. And that, as you said, you shut down. It doesn't mean that in the face of stress or aggression coming at you or whatever, that you don't similarly today just shut down. And the depression is a shutting down.
yeah.
And it's coming up now in this process, in this group here.
Did you kind of look at me and see someone in your past? Because it's usually when you come on as strong as you did, because if you saw it with Lana, and Lana was also, no, it had nothing to do with that, because sometimes people trigger a remembrance, which happened with Walter and me last week. He triggered my stepfather's memory. Well, maybe I triggered somebody in your past, like a nun. I don't know who the hell it could be, but there might be somebody in your past that
Well, it
I
doesn't,
triggered.
Barbara, it doesn't have to be somebody. It can be a pattern.
Yeah,
it can
well-
be something that he
Well,
is
yeah,
being
yeah.
exposed to
you're
that,
not that
that
person.
psychically reminds him
Right.
of a pattern of emotional treatment.
Right.
Yeah, so I've developed what I call like a second personality, dealing with my depression, and I feel like I'm two different people. And I think that I act out like that sometimes, where I feel like I'm sort of switching between one person and another person. But that it's something, that's why I was talking about delusions. And I think that I fall maybe into a pattern where a delusion is a sort of blanket for something else. It's just a way of not acknowledging reality. And I think I've come to a point in my life now where it's become, like having surgery is different, where they rearrange your organs, you know, you go through the whole pain process. But I feel like depression is worse than that. It's sort of like a pain that never goes away, and it just gets worse and worse and worse. And I think my condition has gotten worse than better, although I appear, or I try to look like I'm living a normal life. But when I'm at home, I actually do live a very normal existence. I was saying to Paul how I tend to have more conservative values or views of things, and where I tend to like, well, I don't need certain, I don't need like this kind of, I don't know, this pop culture of, I feel that people, we have television that sort of takes, you know, it takes the place of therapy or the parent or something. I just feel like we live in a society that's driven by a lot of weird propaganda.
Molly, are you at all identified with John?
I mean, maybe with some of the depression part. I mean, but I was kind of fascinated when he was talking about that he. And when I had, I don't know, I guess you'd call it a nervous breakdown, there was more of a feeling of the witness, where you sort of watch your body, or whatever you want to call it, operating in the world, and it's talking to people, whereas my real consciousness is removed. And I keep thinking, or kept thinking at the time, like, how can they believe this machine that's kind of operating out there in the world, because that wasn't the real me.
It's like an out-of-body experience, I think.
So, thus the value of the psychoanalytic edict, put all of your thoughts and feelings into words, because when you have the capability of doing that, you are integrated. You described that you were disconnected
Right.
from yourself. Being able to be conscious and to know everything that you're thinking and everything that you're feeling, it's all you, and you are a whole. And you can't have a nervous breakdown when you do that. And you can't have depression when you do that.
Yeah, but I agree with what you said about depression, because severe depression particularly, especially, I feel the last 6 months I have been going downhill at a very quick pace. I see it, because I see myself from, I mean, you know, losing my mother 3 years ago.
Back, you
Yeah, you see that, you see.
I have a feeling.
Well, for me, I mean, and I'm sure you feel this, and I'm sure you feel it. You know when you're heading to the cliff, because I've said to people, I'm on the precipice and I'm going to jump. And people are afraid, oh, you're going to commit, well, if you're going to commit suicide, you better call the doctor. I said, well, I'm not the kind of person who's going to plan the day and the time and write a note. It's
Okay,
like,
so I'm always more interested when somebody says they're having a feeling in this room about right now. That always calls to my attention, so I heard a little voice in my right ear saying, I have a feeling. So I would like you, when you have a feeling, I would like you to be able to take the power of getting the group to be interested in you and what you're feeling. But I've just done it for you.
Thank you. It does concern someone else. Should I address the person, or should I just start with?
You should address the person
All right.
and how you're feeling.
All right, Barbara.
oh, now how did I know it was going to be me? What, did you eeny, meeny, miny, mo?
In the time between the groups before, you were speaking, and you said something which came across
Let me
something.
interrupt you.
Yeah, go ahead.
Sorry. If somebody said to me, I'm having a feeling about you,
Yeah.
rather than giving the hostile eeny, meeny, miny, mo, how did I know? I would say, I would feel
I'm
excited.
scared.
I would feel excited that somebody's having a feeling
I'm
for
scared
me.
to death, though, from certain
But you,
people.
you can't get hurt by his feeling.
Yeah, all right, whatever. Yeah.
Okay, go ahead, Walter.
you were talking about something, and it triggered a response in me. I had something to say on the same subject, closely related, and you stopped. There was a pause, and so I spoke. And as I spoke, you started in again, totally ignoring me, totally what I saw. This is what I saw. I'm not justifying this either. I'm not saying that it's necessarily right, but what I saw was you totally involved in yourself, not paying attention to me, and speaking across the center there to, I forget who it was, and just that feeling that I felt like initially I think it was hurt, but then the predominant feeling that overtook me was angry. Like I felt a smirk on my face, you know, not a smirk, like a puss on my face. And I don't know, you were just in yourself there, and maybe there was no intention whatsoever, but I've experienced, tried to have something to say, or whether it's related to you or not, and you just go on with what's going on with you and have no perception of me.
Okay,
And that
Barbara, I want to help you to respond to him in a therapeutic fashion.
Yeah, please.
Okay, rather than try to defend yourself,
Angry.
rather than criticize
angry.
him,
I really am tired of feeling angry. I would like to take
Barbara?
another
I
response.
feel angry. I'm sorry. Go ahead.
he privileged you with the communication about his experience with you. So how about the alternative of just appreciating that he shared something with you and not deciding that he's right, that he's wrong, that he's stupid, that he's ugly, that he's, you know, psychotic, whatever, but just that he shared an experience, an emotional experience that he had having to do with you.
Well, I'm
So
not.
if you came from that point of view, what would your response be?
I wasn't surprised or shocked or anything, because as soon as he started talking, I looked at Dee as if to say, I know where this is heading. I mean, I knew right away, instinctively.
Okay,
that
I want Carol's help. Can you communicate with Barbara to help her to understand what I'm after for her?
Even if you don't care what his point is, even if it doesn't matter what his point is, at least can you appreciate that he took the time to say that he cares,
cares about
to communicate with you about what happened earlier, and that his feeling about it was this, and he cares about your response to it.
That was brilliant.
All right, and I would
can
say.
can I add one more
yes.
thing? And that he cares about what you think about it.
I don't know if
He
that-
does.
No, he does.
If he didn't, he wouldn't have cared if you ignored him.
Well, I don't know who I was
He would have
talking to when this
appreciated it.
happened, so I would need more info in
No,
order to
no.
process.
You don't need any more
You
info.
don't need any more
Oh,
info.
all right. Well,
Let me put it this way. Even if I ignore someone and I don't even remember ignoring them, if they come up to me and say, I feel really upset that you ignored me, I feel like, wow, they care enough that I ignored them.
And
Even if I have no
what would your
recollection.
response be, though, to that person?
I'm
Would you say,
terribly
I'm sorry?
but,
that
or I mean, but me saying I'm sorry is not really sufficient. It's like, okay, so now where do we respond?
Well, I might say I'm sorry, and I'd say, I love that you want my attention.
I love that you want my attention.
Because I do love it when people want my attention.
I have another feeling that's come up now that I've expressed my anger. I've started to feel hurt, a little hurt.
I don't, but
and-
both
Don't,
of you,
Barbara, please, don't dismiss
I'm
his
not
feeling
dismissing it.
as being an
You're
illegitimate
cutting me off before you even
Because I
hear
saw
what
your
it's like
body
you're
motion.
getting no. It's like I don't. It's like he's heard about what? There's got to be.
It doesn't
there's gotta be a
matter.
topic.
It doesn't
You're
matter,
judging.
Barbara.
Doesn't
You
matter.
did something that made him feel hurt. Empathy.
I
Let me
didn't
see an
intentionally
empathic.
ignore you, okay? If that's what you're
Barbara,
feeling.
but it doesn't matter if what your intentions were. He could, people, you can't take it personally
Right,
that
right.
people have a reaction to you. You know, people have a, let me put it this way, that microphone over your head, he can have a reaction to that. You think the microphone cares if he has a reaction? No.
Doesn't have any feelings.
I don't think you can make that broad a statement. I think that
Yes.
happens some of the time that you can't take, that it's better not to take it personally, but some of the time, maybe the person should take it personally. And I can't say which is which right
Well-
now. And I just have to say, I'm not necessarily, I know you may have had no intention that had anything to do with me. But I was wishing for your attention. I wanted to make a comment and have you hear it and maybe respond, and you didn't. And I've also seen this happen with me, wanting the same thing before, saying something and you going on, ignoring, and there comes this like annoyance at times, anger at times, and I can't say always the hurt. Maybe it does come, but now I just a moment ago I was feeling the hurt.
You're doing a great job, Walter.
I have felt hurt from you. I mean, I have felt very afraid of you. I think there's a lot of fear of you because of what happened last week. And if Kay were here, I'm sure she would probably agree to that because you don't forget that.
Did you say anger?
Well, it was more than anger.
You said hurt?
I
right?
was
Afraid?
No, I was afraid. I still am. I think that there was the way you came off attacking me a few weeks ago, you just don't forget that. It's not like I put it out of my head like Paul does. And I mean, that's the impression you leave with people. With me anyway.
Please don't make that. All right, thank you.
No, but
With
that's
you.
how
Thank
you have left me to the point where I almost sat on Jane's lap because my body language was like, I don't need this. And I felt totally drained after those sessions and afraid. And I didn't even want to come back, to be honest with you, because I'm saying I don't
Barbara,
I'd like to offer you
Walter
something.
was scary in
Yes,
that past
he
session,
was.
but he's not being scary now, and you're
But I
still
think
back there.
psychologically,
Yeah. Okay. So
I'm
what did I say?
still-
What the cure is?
you
Be
being
here
there
now.
in the moment.
Yeah.
The moment.
Can you do that? He's being very.
I
he's
have to
being
try
very
to do
gentle.
that. That's hard for me to do. It's very.
Barbara.
Yes.
He's being gentle.
Yes, I know he's being gentle. If he were raising his voice, I wouldn't make a.
Okay. Is there some feeling that you have in response to his gentleness?
I think I would feel that he needs to work on that more if he expects to have a diatribe with me
Okay.
A
That's not.
diatribe?
or a dialogue. What do I say?
Diatribe.
I sound like Paul. God help me.
All right, Dee. What do you want to say?
I dreamed
I don't know.
in the time in between, since the last meeting, I dreamed that I might like to do something for you, and I don't know if I could do it.
What do you
But it
mean?
was to, sit across from you, maybe at a little distance, and let myself be your target and let you have your say.
I don't want to do that because you did it to me, and I felt like I was a dartboard. I had these darts coming at me at 100 miles an hour, and I felt overwhelmed, and I felt post-traumatic stress coming, and I'm like, I need to see my real therapist now.
Walter.
Well, I'm not saying that I could actually
I don't
do
want
it.
to do that.
Oh,
That's
all right.
not
Well,
me.
that's
I
all
don't,
right.
Walter.
But-
I wouldn't even allow you to do it.
Yeah, please.
I mean, we're
Yeah,
not here to
I was aware of that too when I
targets.
thought of it. But I just
No.
wanted to make that much known.
You have to understand, this is draining. I am tired of being angry. Anger is a very destructive emotion if it's constant.
Walter, I love the idea that you want to give a gift to Barbara, but I
It's not the
can't
gift.
allow you to give a
It's the
gift
gift that keeps on giving.
that would be at your own sacrifice.
I wouldn't do it. I mean,
That-
I don't
that's not-
want to
that
have
would
to
not be
yell
good
at
for you.
people on a constant basis. It's
Well,
like being in my house.
the thing is with me, I know that hearing anger from a woman can be overwhelming to me, and in the past has brought up this feeling in my chest that makes me start to have to scream, and usually scream back at the person. But I still feel at times, I feel this towards men too, that there are things that go on with people I've known, and I see they've got old feelings, hurts, angers, and a part of me wants to, perhaps make a sacrifice and perhaps not, but serve them in some way by letting me be a target while I find my ways of protecting myself, which I've learned, like a little distance and maybe I can cover my ears momentarily so I only hear it partially, or I can go into a fetal position, but still allow them as much as I can while maintaining enough protection so I feel not damaged. And I know that also sometime later I could also have my feelings about it and cathartic.
That's having
So-
integrity.
That's interesting.
Having a shred of integrity.
Well, I
That's not
guess you could say
integrity.
that.
That's how I
that's
call
not
it.
that's not integrity. I don't want to have to sit here for an hour and throw
No, I'm
darts
saying
at you.
he's showing his integrity is that he likes to keep a distance between.
He
his
said something
feelings.
very interesting though. He
Excuse
says
me,
women.
did we lose a group member?
Women more than men,
did.
generally.
We
I
did.
can
Yeah.
But that's very
Barbara,
telling.
men
Barbara,
more than women in that
Yes.
respect.
Hello?
Guys.
We lost a group member. Did anyone notice?
Yes, I
Yeah.
think she said she had to leave.
Molly.
No, Molly had
Molly
to
had
leave.
to leave.
She crawled
wanted
out.
to-
She
Okay.
crawled out in the middle of the session.
She slipped
She didn't
out.
die.
She
She's
didn't want to
just
slip out during the
temporarily
shot, so
gone.
when the shot went this way. she
Okay,
crawled.
well, you know, we're
She's on her hands and knees at
That's
this
right.
we're
point.
talking
We did.
about process as opposed to just doing it. So
No, we know. I noticed.
it's
I
important
noticed it.
to acknowledge
I'm not
that
blind.
there's an empty chair
It was
there.
pretty smooth, yeah.
Yeah, it was very smooth. But he said something that the wording that he said was very frightening for me to hear. Is that women in particular cause him to get
It
very
goes back to his mother.
angry.
It goes back to his mother.
Well, and I feel like a few weeks, it just confirms what I said about what happened a few weeks ago, that this can happen again. And I don't want to yell. I'm tired of yelling. I'm tired of leaving these groups and feeling like I want to go home and get back into bed and not wake up for 20
And
hours.
Barbara, I'll tell you how you can have a different feeling.
Getting high? I don't know. I mean, taking ecstasy.
Would you like to know?
Yeah, sure. I mean,
Okay, well, you have to
live in
you
the
have-
here and now.
No, you have to stop talking so that I can give the answer. You have to actually be interested in the fact that I asked that question. Would you like to know that? And you have to be interested in what my answer would be.
No, yeah, I would like to know that because I feel that way every time.
You just have to cooperate with me. You have to stop trying to talk over me. You have to actually be interested in what I'm saying and process it. And if there's something you don't understand, you can ask about it. But if you don't cooperate with me, you're going to keep having the same experience over and over again. Does that make sense to you guys?
Yes.
Yeah,
Well,
does.
partly to me.
Of course,
is
partly to
partly.
you.
Yeah, if
all
you're not
partly.
interested and you feel that strongly, I think if
But you
you
never
can
say you're holy.
express the feeling of that, you will be
But
in the
partly
process
means
of
you're
getting
partly
past
not
it,
it.
so you can become maybe truly
The
interested
glass
in
is
her.
half full, the glass is half empty. Partly
It's
means
like
you're
that in
partly.
life a lot. There are lots of multiple causes and parts of things.
But don't you want to have a whole experience? I'm tired of being partly in the group and partly being attacked and partly being cared about.
Well, having a whole experience is
mean-
not going to be gotten to by denying when there are multiple causes and multiple reasons.
And what about you? Can you cooperate with me?
I'm so glad it's off me for 5
some.
minutes.
Partly.